Hi, it's Gary Chimes from Lake Washington Sports and Spine, and what I want to talk about today are options for moderate to severe knee osteoarthritis. So when we're dealing with knee osteoarthritis, there's options I would put on the conservative side to the most invasive side. And let me start with the most invasive first, which is knee replacements. Typically, if I'm seeing somebody with moderate to severe knee osteoarthritis, there's a good chance that they're going to need to have a knee replacement at some point in their lifetime. We used to say that knee replacements typically lasted 15 to 20 years. I think they're getting a little bit better, so it's probably the most recent data suggests that they last 15 to 25 years. So what does that mean? Part of it is people are living longer. So if I see somebody, let's say they're 55, their life expectancy is probably into their mid-90s, which means that they may need to do knee replacement number 2. So one of the things that we'd love to do is avoid a knee replacement if we could, and we would especially love to avoid a second knee replacement. I also think that there are things on the horizons. There are studies that are being done now on gene therapy that look promising. So one of the things, if we can buy somebody 5 to 10 years, that might be a bridge to gene therapy, which might extend the time before a knee replacement even higher or make the potential even better. So then what are the other options that we have? And I'd say they would be lifestyle modification, rehabilitative exercise, palliative treatments, and regenerative treatments. So let's kind of break those down. Lifestyle modification is actually probably the most important one, and the most important by far is going to be weight loss. Even if you're somebody who is a very muscular person who doesn't have a lot of fat, having a high body mass index is still going to be hard because the limiting factor for a knee joint is going to be the cross-sectional area of the joint. So if you have a lot of mass, which is going to be a volume, that's to the power of 3, and the cross-sectional area of the joint is to the power of 2. So weight really has a big effect on the joint. And then doing regular exercise, typically doing, especially in the American College of Sports Medicine exercise guidelines of 150 minutes of aerobic conditioning a week. Now I find a lot of people just kind of yada yada over that conversation. You know, if I talk to them about weight loss, they're like, yeah, what else you got? But I do think that that's a really important thing, is to really optimize your weight, because that's going to be the biggest limiting factor for the knee. The second thing is going to be rehabilitative exercise, and that's going to be doing exercise in the setting of pain, often done with a physical therapist or a chiropractor. One of the really important points is that a lot of times people will say they're working with a personal trainer or they have a lifetime of exercise. They might be experts in doing exercise when you don't have knee pain, but it's a different skill set of doing exercise when you do have knee pain and learning how to modify those patterns. So this is another option that finally gets glossed over a lot. Another treatment that's going to be helpful are going to be palliative treatments. Please see some of our other videos talking about why I don't think medications are a good choice for knee osteoarthritis. But when we look at things like cortisone injections, and cortisone injections still play a role. For example, if I'm seeing somebody and they're about to go on a 2-month vacation in Europe and they want to make sure they have less knee pain on that trip, cortisone tends to work pretty quickly and can really help somebody enjoy that event, just with the caveat of understanding that they may not have the lasting benefits that they're looking for. And then I think one of the really hot topics are going to be regenerative treatments, things like platelet-rich plasma and stem cell type treatments. I put stem cells in the quotes here because we're not really dealing with isolated stem cell lines. We're talking about more things that stimulate stem cells, like micronized fat. And these are things that are done to help create a healthy environment for the knee joint so that the healing process can occur and hopefully be a bridge to a knee replacement. I think this is a really exciting topic, but I think one of the important things is if you're pursuing these routes, looking at regenerative treatments, it really should be done as part of a comprehensive program that's including lifestyle modification, rehabilitative exercise, that's going to be really making sure you optimize the success of the regenerative treatments. So this is Gary Chimes at Lake Washington Sports and Spine.